we must always be prepared to respond and adapt to emergency situations. However, some among us must take this planning to an entirely different level because of their primary role to assist people who are already in crisis. In July 2024, after reviewing an after-action report from other hospitals across the state following hurricane-related evacuations, UF Health Jacksonville Emergency Management Program recognized the need to test this evacuation plan specifically for infants, children, and mothers. After a year of planning, they conducted a full-scale pediatric exercise for their neonatal intensive care unit, pediatric intensive care unit, neonatal abstinence syndrome unit, labor and delivery, and mother-baby units. Through this exercise, they identified best practices for establishing an alternative care site, pinpointing the supplies and medications needed for a minimum of 3 days, and developed more effective methods to track patients and staff. Over 15 internal departments and external partners joined this effort, including the Jacksonville Sheriff's Office, Jacksonville Fire Rescue Department, the Region 3 Healthcare Coalition, the Red Cross, First Coast Disaster Council, Florida Division of Emergency Management, Century Ambulance, Trauma One, and the City of Jacksonville's Emergency Preparedness Division. I'd like to invite Jennifer Silvey, Kassan Disaster Management, University Health Jacksonville, on the stage to accept this award. Congratulations on the 2024 Regional Award for Excellence in Healthcare Emergency Preparedness.
This is the Golden Globes. I'm ready. It's my turn now. I want to thank my agent. No, thank you so much for being here today. Those of you who know me know that I will get up and say a few words. One of the things I want to say is thank you so much. You guys have always been such a supporter and a champion for our hospital and emergency management. I am deeply honored to stand here today and accept this award for UF Health. This recognition is not just a reflection of my hard work, but it's a testament to the incredible team and community that supported and championed this project. I was deployed during Hurricane Ian and heard the stories from Lee Health. They evacuated little babies and newborns and mothers and patients. And I came back and I said to our team, what if? What if that happens to us? It took about a year and we planned this event, peeling back the onion. What questions are we not answering? What things are we not thinking about? And together, this incredible team that I'm gonna bring up in just a second, they were able to set some best practices that we can use anywhere in the hospital, at any hospital. And by the way, no other hospital has exercised this type of disaster evacuation. We did it, and it was scary, and it was uncomfortable. But from the first meeting, the exercise was already a success because we were having conversations that we never had before. So we won. We were already ahead of the game. First and foremost, I want to give my heartfelt gratitude to our hospital leadership. Without their support and their championship, our hospital emergency preparedness program wouldn't be where it is today. Our hospital leaders, they speak that disaster language. They walk the walk and they talk the talk. And when leaders and leaders like yourself and elected officials speak that word of preparedness, speak that word of emergency management, your communities and your staff and your people, they're gonna listen and they're gonna do the same thing. I also want to express my appreciation to our community leaders who stood beside us. That's the Duval Emergency Preparedness Department, and they are amazing. Our Nassau County, our Clay County, our Baker County, EOCs, it's that relationship that we have built with them, our St. Johns County relationships, that now, before disaster strikes, we already know each other. We've already had those conversations. And like you said earlier, the Healthcare Coalition, Jacksonville Sheriff's Office, the Jacksonville Fire Department, Florida Department of Emergency Management, they were all there during that day of this evacuation. We evacuated 30 to 45, don't get worried, they weren't real babies, but we had babies that we evacuated. Together, we all demonstrated the strength of partnership, how it can directly affect the safety and well-being of our community members, especially our most youngest and most at-risk populations. This pediatric evacuation exercise was more than a logistical endeavor. It was a reflection of all of our shared values and our shared preparedness and our shared goals for our communities. I'm incredibly grateful to the hospital staff, to the emergency responders, and to the volunteers who brought their expertise and brought their passion that day. At this table, I have some incredible people. All I did was say, here, what do you think of this? They did the hard work. Our Women's Services Department at both of our hospitals, our Downtown Hospital, our North Hospital, they came together and they developed best practices. How are we going to track our patients? We had a woman go into labor while she was being evacuated. I mean, that was incredible. So I'm so proud of the work all of you have done. And if you would please help me give a round of applause to my whole table. But guess what? We're 9 days into 2025. Camden County just saw an active shooter. We had a truck explode, one of those Tesla trucks. There are wildfires in California, and then New Orleans. And we're 9 days into this year. What happens in 6 days? What happens in 18 days? What happens in 6 months and 9 months? We have to have those conversations with each other. We have to get our communities and our staff and our people prepared. And I can't do it, we can't do it without you. So thank you all again. Thank you to our amazing women's services and our hospital, and thank you all for being here today.